All right, today we're going to dive into a condition that affects millions of people but is so often just brushed off as, well, just being tired. We're going to break down exactly what anemia is and what it really means for your body. So let me start by asking you something a lot of us have probably asked ourselves. Are you tired of being tired? I'm not talking about regular end-of-the-day tired. I mean that deep, bone-weary exhaustion that another cup of coffee just can't seem to touch. You know, that feeling of exhaustion that just hangs around, that weakness, maybe even noticing you're way more sensitive to the cold than other people, that's not just in your head. And it's not always about a lack of sleep. It could actually be our bodies sending up a flare, a really important signal that something is out of balance. To really understand that signal, we've got to look at what I like to call your body's critical oxygen delivery service. It all comes down to what's happening in your blood. So the technical term for this whole process is perfusion. But honestly, just think of it like a massive, super efficient courier service for your entire body. Your blood is constantly flowing through every single artery and capillary, delivering oxygen and nutrients to every last cell to keep the whole system up and running.
So, what is anemia? Well, in the simplest terms, it's a major breakdown in that delivery service. It means you've got a shortage of red blood cells. Those are the delivery trucks themselves. Or you have a problem with the hemoglobin, which is what actually carries the oxygen packages. When that happens, your cells are starved for the oxygen they need to function, and that's what leads to that system-wide fatigue.
But here's the thing. Anemia isn't just one single issue. That breakdown in the delivery service can happen for a few different reasons. So let's take a look at the three core problems that cause it. When you really get down to it, anemia pretty much always boils down to one of three things. First, you might have a production problem. Your body's factory just isn't making enough red blood cells. Second, you could have a loss problem. You're losing those cells faster than you can replace them. Or third, a destruction problem, where your red blood cells are being destroyed way too quickly.
Let's dig into those production problems a bit. On one hand, you've got iron deficiency anemia, which is actually the world's most common nutritional disorder. Think of iron as a key ingredient. Without enough of it, your body just can't build the hemoglobin it needs, and the whole production line grinds to a halt. Then you have something like megaloblastic anemia. This is often caused by a lack of vitamin B12 or folic acid. Here, the body tries to make the cells, but they end up all wrong. They're too big, they're fragile, and they're defective, because their basic DNA blueprint is flawed.
Then, of course, you've got the other two big categories. Blood loss can be really sudden and obvious, like from a major injury, or it can be a slow, chronic leak you might not even notice. And then there's that destruction issue, which is called hemolysis. This is what you see in conditions like sickle cell disease, where red blood cells are just destroyed way faster than the body can possibly keep up.
But here's what's so important to understand. Blood health isn't just about having enough of something. It's an incredibly delicate balancing act. It's not just about what you're lacking. Sometimes the problem is actually having way too much. So the crucial point here is this. Your body operates in a just right zone. Having too little of something is a problem, for sure. But having too much, that can be just as serious.
Take polycythemia vera, for example. It is literally the polar opposite of anemia. In this case, your body goes into overdrive and produces too many red blood cells. This actually makes your blood thick, almost like sludge, which messes up circulation and can lead to things like vertigo and constant headaches.
And this whole balancing act applies to other things in your blood too, like platelets. These are the tiny little cell fragments that are absolutely essential for clotting. When you get a cut, platelets are the first responders that rush to the scene to plug the hole. While thrombocytopenia is a condition where you just don't have enough of them. And the stakes here are unbelievably high. A normal platelet count is somewhere between 150,000 and 450,000. But if that number drops below 20,000, you are at risk for spontaneous, life-threatening bleeding. I mean bleeding that can happen without any injury at all. It is a powerful reminder of just how critical this internal balance really is.
Okay, so we've talked a lot about the problems. Now, let's shift gears and talk about solutions. Let's get into the management playbook, an action plan for what to do. Now, of course, the specific medical treatment for anemia is going to depend entirely on its cause, but there are absolutely effective strategies for managing that one most universal symptom, that relentless fatigue we talked about at the very beginning. And here's a simple but really powerful framework. It's about working with your body instead of fighting against it. Alternate between periods of rest and activity to conserve your energy. Prioritize. Figure out what absolutely has to get done. Be realistic about your energy levels. And this is a big one. Don't be afraid to ask for help to stay safe.
Now, if we're talking about the most common type, iron deficiency anemia, the game plan gets more specific. It has to start with an iron-rich diet. And you can see why certain groups are more at risk. Women who are menstruating or pregnant have higher iron needs, for example. But it is so crucial to work with a doctor to figure out the root cause and then really stick with both the diet and any therapy they prescribe.
And here's a golden tip for anyone who needs to take an iron supplement. Timing is everything. For your body to absorb it best, you need an acidic environment. So the trick is to take it about an hour before a meal and take it with something that has vitamin C, like a small glass of orange juice. It makes a huge difference in absorption.
And while we're on the subject, a few more really practical tips. If you're taking liquid iron, use a straw, because it can definitely stain your teeth. Also, don't be alarmed if your stool turns black. That's totally normal. It's just your body getting rid of the excess iron. And finally, since iron can cause constipation, it's a really good idea to talk to your doctor about a stool softener right from the start.
So, as we wrap up, let's just come back to the big picture. Anemia is so much more than just a diagnosis. It's a signal. It's a signal that your body's absolutely critical oxygen delivery system is under a lot of strain. And that's a signal you really shouldn't ignore.
Your blood tells an incredibly complex, detailed story about your overall health. So the question I want to leave you with today is this: what is your story telling you?